Thanks for doing the work that you're doing. I mean, this is not only a call to service, it's a call to action. And I'm hoping that you'll use your most abundant resource to make something big happen. And your most abundant resource is your imagination. Actually makes us uniquely human. And I'd like you to think about this not in terms of limited resources, but in terms of what you could do if you had all the resources that you had at your disposal. Let the politicians, let the electorate worry about the resources, but go big with this. So I'm a psychiatrist. I run the Mental Health Center of Denver. I've been doing this kind of work for 30 years. It happened because of my dad, who had bipolar disorder, and I felt like we were lucky. We were lucky there was a state hospital that had capacity to take my dad in when he was very, very ill. We were lucky that there were people willing to work at low wages to do this kind of meaningful work. We were lucky that people hung in with my dad when he thought the idea about having a mental illness. We were lucky he didn't kill himself the times that he tried. I had a great dad. When he finally got onto the idea that he had this illness, and he said, wow, I really need to do something about this, my dad got well. And that's why I do the work that I do. You know, I don't want it to be based on luck. I want it to be based on we have a system of care where people actually get what they need. And we don't have that right now. So some things you already know. 1 out of 5 people are dealing with a mental illness or an addiction at any given moment. In Colorado and the whole country, 2 out of 5 are getting the care that they need. That means 3 out of 5 are not getting what they need. We can solve this access problem, but it's not going to be easy. And part of what's not easy about it is that if you look at the workforce that does this kind of work, from 2008 till now, it's decreased 14%. So we're not going to be able to meet the need with our old kind of ways of doing things. We've got to think about how can we scale things, how can we be more flexible, how can we use technology in a way that gets people what they need. Wouldn't it be great if we had digital access to any kind of service that you needed? Right now in Denver, you can go to Claremont and Colfax if you know about it, and go to our walk-in clinic that's open 24/7. But if you don't know about it, you don't know what to do. So we got to make access easier. Depression is the #1 debilitating illness in the world. And if you look at people that are dealing with depression, less than half of them are getting the treatment they need. And what are the barriers to that? It's all kinds of things. It's things like, oh, well, there's that Colorado crisis line, but I'm depressed, but I'm not really in crisis, right? We haven't made it easy for people to make that decision about doing something to improve their well-being. So let's try to change that equation. So people talk about sort of a fractured system, but let me tell you where my world is. We've divided the brain up into many different little parts. You have a stroke, okay, you go over here. You have autism, you go here. You have a developmental disability, you go over here. You're dealing with emotions, thoughts, feelings, okay, well, you go over here. We've divided it up. I have 140,000 billing rules to figure out who to charge when I see somebody. It's sort of like, what's your background, what's your gender, what's your this, what's your that, to make sure that the right place gets billed. So our state, as an example, has over 400 pots of money for behavioral health. They all have their own contracting, they all have their own rules, they all have their own sort of like outcomes they want to look at. That's an administrative nightmare. But do we do it? Yeah, we do it, right? Because we want to bring the resources in. So the need is this big, the workforce is this big, and the resources we put towards it is this big. And that's not just true for Colorado, that's the whole planet. If you look anywhere on our planet, you look at the need, and you look at the resources that are put towards that need, we're developing nations everywhere in the world. So wouldn't it be interesting? Wouldn't it be great if we could imagine Colorado was the first place in the world that put enough resources towards the mental health of folks that we actually made the difference that we could make? I think we can do that. Now let's talk about some glitchy things that happen. So in science, when we learn something that makes a difference for somebody's brain, for their well-being, for their mental health, it takes usually 17 years on average to get that out into the community. Now, it happens a little bit faster with drugs, but I'll even give you an example of where that's a problem. Spravato, which is a nasal form of esketamine, is available today. Has our state stepped up to the plate to make it available? No. Do they have plans to do it? Yes, they have plans. There are people today that could use that, and maybe in January, they might figure out a mechanism to pay for that treatment. Now, if you have private funding, you can get it today. You know, if you can pay out of pocket, which is a whole nother issue in our industry. So I'm trained as a psychiatrist. I decided to do this work in this field, in this area, because of my history with my family. But I could very easily say, you know what? I'm done with this. I'm not going to take insurance. I don't need to take insurance. I can just have people pay out of pocket. You know why? Because there are enough people that have enough money to pay for my services that I'll be full and I won't have any trouble at all. And I won't have to deal with insurance companies, I won't have to deal with paperwork, I won't have to deal with any of that. So we have this situation where if we don't compete for talent in our state, we're going to be left behind. And how do we do that? We've got to put more resources behind that. Good thing. I'll just say one other thing, which is racism is a big issue in this whole field too. And if we don't address that as we go forward, we're going to see disparities that continue to happen. There's lots of implicit bias that happens and where people land in our whole system. If we don't do something to address that, it's not going to get any better. There's a couple things. One is the loan forgiveness programs are a big deal because it costs a lot of money to become a therapist. You know, so most of the social workers that come to work for us have $160,000 in school debt, and they're taking a job that doesn't pay that much. So that's a very big helpful thing. The other thing is we've got to do something about the pay. So not through malice, but our state has had a sort of methodical way of raising rates, which has been 1% a year. But what that means over the past 20 years, the buying power of mental health centers in our state has decreased 38%. Now, OBH has actually done a good job of making an argument to the legislature for their staff, right, about, look, the private area is paying this, you know, when we're paying here, we've got to get bigger increases to attract talent. And that's happened there, and it needs to happen on the mental health center side too. It did happen last year, but it had a glitch in it. So the JBC actually gave a bigger increase, but then they say give it to all providers. It's like, that doesn't help the mental health centers if all providers get the bump, right? Because we're competing with folks that are in the private part. So we believe that it's much easier for somebody to make a decision about improving their well-being than to decide if they're sick enough for treatment, right? So it's like, you know, if you want your well-being to be better, come see us. You know, we know how to treat the illnesses of the brain. You may or may not have that, but isn't it welcoming just to say, I would like my well-being to be better? And here's the fascinating thing from the science of well-being. So the better your well-being is, the better it is for everybody around you. It's really interesting. So this is what the science has only been around for 20 years. But what the science shows that if you have a friend whose well-being is good, they have a 15% influence on your well-being to the positive. If you have a friend who has a friend whose well-being is good and you don't even know them, it has a 6% influence on your well-being. And then it goes the opposite direction too. The numbers aren't the same. But if you have a friend whose well-being is not good, it's 6% to the negative. So we're actually all very connected. And the better we do for everybody in our community, it's actually good for everybody in our community. So we're trying to break down those barriers of us and them, which happens in mental health all the time. you know, those people with mental health issues. It's like, that's all of us, right? We all have our ups and downs and those sorts of things. So how do we bust that door wide open and improve the well-being of everybody in Colorado?